only 14% of the intensive care unit capacity remains in the entire county right now. Just yesterday, 67 COVID-19 patients were admitted to hospitals, and that is an all-time record. And hospitals are now canceling surgeries to care for this influx of patients.
It takes at least 3 weeks for our actions to impact the trend in hospitalizations. At least 3 weeks. It's a very long lead time. And in our county, we're already a little bit behind.
KPIX5 reporter Wilson Walker spoke to the chief medical officer at Santa Clara Valley Medical Center a little while ago. Wilson, what do they have to say?
Well, this really all comes back to the very basic elements that we were all concerned about at the beginning of the pandemic. You heard them mention just the basic ability for hospitals like this one to care for patients here in Santa Clara County, already within that 15% threshold. So what are they doing to prepare? Well, they've already done it. They've done all the things we showed you going back to March. What are they worried about? Well, it's not so much the beds and the space, it's people.
My name is Dr. Fong Wen. I'm the Chief Medical Officer for Santa Clara Valley Medical Center.
Amid a steadily climbing surge of patients, this hospital is now increasingly relying on the emergency measures it started taking back in March.
Part of the reason that we are not a stress currently, as far as strain currently, is because of all the work that our public health department have done up to this point.
This is a basic staging currently.
Same story up in San Mateo County. These overflow tents, they were readied back at the very start of the pandemic.
We would then do an initial assessment out here. They would be safely, if they're critical, we would safely be able to intubate these patients and then bring them into our facility.
Most of the physical surge preparation was done months ago, and hospital space is not much of a worry. So what might be the first part of the system to feel some strain? Well, for Santa Clara County, they think the crunch might be staffing because medical professionals can only be shifted and stretched so far.
From, let's say, ambulatory to inpatient, from one facility to another. So currently, we have adequate staffing. At some point, if we don't get this surge under control, we will run into staffing challenges.
Yeah, Wilson, you can't just have volunteers go in there. I mean, you got to be trained. You got to have trained staff with life-saving experience. Staffing sounds like it could be the main concern. What can the hospitals do right now?
Well, I think this really speaks to the regional strategy that the state has moved to. What hospitals normally do is they start sharing professionals sort of within the region. But as your region gets overwhelmed, remember Santa Clara is sort of not by itself here, then you start running out of people to share. I think that is the concern, that if things get bad in one particular spot and there's another county that's heading towards the same kind of trouble, you just start running out of people to move around. That, I think, speaks to the regional approach that the state is steering towards, trying to keep large areas above water, because once you start to lose capacity in sort of a region, not enough people to go around. As you heard, that now sort of the main front-end concern as the surge continues. Ken?
Do not want to get into that situation. Wilson Walker reporting live from San Jose. Thanks, Wilson.